The next topic is on wide field fundus photography, a boon for the comprehensive ophthalmologist. And the speaker is none other than our chairman of the academic, PRASHANT BAWANKULE. You may all be very familiar with him since he has recently been elected to this post. Still, a few words of introduction are in order. Dr. Prashant is the director of Sarakshi Netralaya, Nagpur. He is also the honorary associate professor at the Indira Gandhi Medical College, Nagpur. He is basically a vitreoretinal surgeon by profession, and having done his fellowship from Shankar Netralaya. But he is quite adept in anterior segment as well as trauma surgery also. He has held various posts like President of the Maharashtra Ophthalmic Society, the Vidarbha Ophthalmic Society, Treasurer of the VRSI, OTSI. He has also won various awards which I am not enumerating here. He seems to like adopting new technology. He was one of the pioneers of 3D assisted surgery and now wide field fundus photography. Over to Dr. Prashant.
Thank you, Dr. Arup, for this wonderful introduction, and thank you KSOS for this wonderful opportunity. It's my fourth visit to KSOS and Thrissur in proper, to be specific, and I had the opportunity to have a Guru Vayur Darshan early in the morning. So now back to my topic. I would be speaking upon the value of wide field imaging, how it can change our diagnosis and all. How do I pay? Okay. So these are the various options which are available in market today, where you can see the field of degree can vary from 135, 163 degree. On an average, the normal fundus photograph on a fundus camera, you see a view of only 35 to 40 degrees. And if you add a 7 field, you can see up to 70 degrees, not beyond the equator. And aura to aura, the dimension is almost 220 degree. It means we are just seeing one third of the retina, and based on that we are presuming our diagnosis to be based upon it. So that is the reason with this new toy we can think something different, and it can challenge the way we look at a particular disease. First we'll talk about the wide field OCT. In a standard field you see a scan width of about 9 to 12 millimeter, length rather I should say, and in a wide field you can see up to 16 millimeter, and now we have a technology where you can have a scan OCT right from aura to aura as big as this. And it offers you, especially when you have a concomitant pathology as well as extramacular pathologies. These are some of the books, pictures. I will just come to my particular case. She is a 80 years old mother of a pathologist who complained of decreased vision, and this was the fundus photograph. As you can see in a wide field photograph, you have a lesion in the temporal periphery, which is a peripheral PCV. And this was the OCT. In fact, you can, OCT where you can see a lesion. Can we have a pointer over here? How do I use it to point it? So it was, if you see in the upper part, there was, you can see some fluid creeping into the macula. So in the old OCT, you could just pick up the central part. While with the wide field OCT, you can go through the lesion. Actually, you can see how the lesion is behaving. And basically, then we started treating it with a rolosizumab. And you can monitor actually even the peripheral lesion, how it is decreasing with time and responding to our treatment or not. So this is one of the examples of wide field OCT. Now this is a patient who was diagnosed as an epiretinal membrane and advised vitreous surgery elsewhere. And you can see in this particular picture, when you have a wide field OCT, you can not only see epiretinal membrane here, but this is the reason, means it has a concomitant other pathology in the form of a proliferative fibrous tissue over there. And this was what we got on a wide field OCT. If proper scans were taken, you could see that membrane was leaching here, leading to lamellar hole, and this is how it changed the way we look at it. Now this is another patient who had a normal OCT presumably, and this eye probably we thought we are seeing something abnormal. But on a wide field OCT you can see there is a simultaneous, you are having a peripapillary schisis as well. So this is how a complete panoramic view helps you in better diagnosis. Now for diabetic retinopathy, which is the commonest indication for doing various fundus photography or angiography, you can actually quantify the areas of non-perfusion, and you can do what is called a targeted laser therapy. Now let's see this particular patient advised as macular edema and advised anti-VEGF elsewhere. She is a diabetic 91, and he is a diabetic 9 years old, diabetic, and complain of decreased vision. And when we do a wide field OCT, you can see the sciatic cavities are extending much beyond the central FAZ, and it changed our diagnosis to retinoschisis with a concomitant macular edema. So it was not a diabetic macular edema, but the patient complained of progressive loss of vision. In a retinoschisis, visual loss is expected, macular edema is known. Why was it progressive in nature? We did an angiogram, and when we did an angiogram for this particular patient, as you can see in a wide field angiogram, you can see a telangiectatic response in the extreme periphery, which can never would have been picked up on a standard photograph, because in a standard angiogram, this is the area of visibility. So we had to treat her with laser, this area, as well as with anti-VEGF, and it explained why this patient had a progressive loss of vision in this particular case. Now look at another case. This is a patient who was diagnosed to have retinal detachment. I thought I am seeing some fibrous tissue over here. When I looked at the peripheral fundus of the other eye, which was asymptomatic, I saw some fibrous tissue. I was not ready to accept the diagnosis of simple detachment. And when we did a wide field angiogram, you can see a FEVR in both the eyes. So what it helped me in changing my diagnosis, I first treated this eye with a laser and averted a disaster which had already precipitated in the left eye. Of course, we operated the left eye with vitreous surgery. Otherwise, a partial detachment, we could have even thought of about a buckle. Now this is post-op for the left eye. Now this is another case, 52 years, female, diabetic, hypertensive, and this is for floaters. Patient was diagnosed to have epiretinal membrane, advised vitreous surgery. But when we look at a wide field photograph, I thought there is a pulling up of the blood vessels over here. And when we did a wide field photograph, you can see there was again a case of a FEVR. This is post-operative photograph. So we did vitrectomy, endolaser, and this is the Ozodrex implant which was placed here. So this is how it changes your way. This is 48 years male who had hypercholesteremia since 7 years. And this was what diagnosed as a rod spot elsewhere and advised simple angiography. When we did a wide field angiography, you can see a shutdown in the extreme periphery. Usually on a standard photograph, you would have picked up and you would have missed out this peripheral. So in this particular case, we just did a targeted laser in the extreme periphery, quite anterior to the equator, and we could salvage the field of vision, posterior field of vision. So this is what we see on a wide field angiogram. Bilaterally, the disease was there. So this was peripheral vascular occlusion. This is another case where you can see multiple sclerosed vessel in this eye, and patient, when we did a wide field and had a lamellar hole over here on a wide field OCT. And you can see in half-zone disease in a case of an elderly. Usually half-zone disease is a terminology which we use in a case of a ROP. This is what we have sent for present publication, half-zone disease, and this patient had a bilateral carotid disease. Now another case, 26 years female, Montaux positive, and this is what she came with. This was a healed case of uveitis when she was complaining of progressive loss of vision. We could not explain why was there a progressive loss of vision. We did an angiogram in this particular case, and we could see the peripheral dropout in this particular case. So this was a case of a peripheral vascular ischemia in the periphery in a case of a healed uveitis. We just did a peripheral laser and it responded to our treatment. Yeah. So another case of a similar case of a choroiditis had a vitreous hemorrhage. We did a wide field angiogram. You could see a vascular response in the extreme periphery, which needed just a targeted laser in extreme periphery. This is how, and we could spare the posterior pole, so the patient's field of vision was not affected. Now this patient girl was diagnosed as a Eales disease and advised vitrectomy for this particular patient. Yes, of course, she had a proliferative vascular retinopathy with a combined retina detachment. But when I looked at the other eye, I thought I am seeing something different. It was pruning of the vessels. For the sake of postgraduate, this is classically called the pruning of the blood vessels. And when we did a wide field angiogram, we could pick up a case like this in a better eye. So we treated the better eye first, which was asymptomatic by laser, and averted a disaster. Of course, the other eye underwent a vitreous surgery and was treated whatever necessary. Now this patient has another 1 minute, sir. Thicical following right eye had thicical eye because of operated. This was the history which was significant, and this was the patient's fundus photograph. Even to the best of the eyes, I thought this fundus photograph was normal. But I had to trust this particular part. It was creating an index of suspicion for me. So I decided to do a fundus fluorescein angiography and look at what I could pick up. Multiple vascular tumors in the periphery, which cannot be picked up on a standard fundus photograph. So this was a case of a VHL. We treated here the patient with the laser. Now, post-treatment follow-up can be also well done. Now, father was asymptomatic. We decided because it can have a genetic link, we did a wide field angiography. Again, you could see multiple angiomas in his eye. Similar was the case with her asymptomatic brother, where we could pick up multiple lesions with a wide field angiogram. Of course, we went ahead with the genetic and all other studies, treated him. And in this case, especially for the sake of postgraduates, you have to repeat 1 yearly wide field angiography to see for any recurrence. We did a genetic study and we could identify the gene in this particular case. Now, this is a case of CSR diagnosed elsewhere, but when we saw the picture in a wide field OCT, we were not convinced, and this was a case of a VKH. I would just run through this presentation now. There are multiple such cases. This is again the multiple blisters which I can pick up on this case of a wide field photograph. And this patient was diagnosed to have a night blindness and was diagnosed to have macular edema, rather retinal edema in one eye. When we did an angiogram, this is a case of simultaneous retinitis pigmentosa with CRAO. So I will just sum up my case over here that many a times, as I said, in a wide field imaging techniques, you visualize almost 220 degrees, and this is possible with these newer technologies. Previously, with the standard for fundus cameras, we can only visualize the central 170 degrees or maximum 80 degrees, and it challenged us the way we are looking at the disease, and it can definitely modify the treatment and give us a better clue. Thank you.
Thank you, Dr. Prashant. Like wonderful photographs, really. Yeah. So, I mean, like you have really illustrated the use of this particular technology to pick up so many cases which could have been missed otherwise.
Yes.
Yeah. But I think what would be the cost of that? Would be
The only cost is prohibitive. It comes in 6-7 digit, I should say. But what we miss in this case is it's a passion. If you are looking at, if you are predominantly a retina surgeon and who wants to pick up things and go for publication. In fact, my last slide was the amount of the publications. We have about 10 cover pages, all contribution, and that is what I call return on investment for my investment, which I've done with these machines.
Okay.
Thank you. Thank you.
Thank you. Thank you, Dr. I request Dr. Tushar, can you give the memento to Dr. Prashant?